Good evening, I am Dr. Lata Bhat. I am a pediatrician specially trained to handle developmental problems of children and running Palak Child Development Center in Mayur Phase 2, Delhi. Today I am going to talk about autistic spectrum disorder. Earlier I spoke about how to suspect a child for high risk for autism based on signs and symptoms. Today I am going to talk about the evaluation and management of such children. Autism is a social communication skills disorder where there is impairment of non-verbal and verbal communication both, and there are repetitive behavioral patterns which impair a child's day-to-day functioning. Speech delay is the commonest presentation, although there can be some intellectual disability in some children. So early intervention is very, very important because in earlier years, especially below the age of 3 years, brain has fantastic capacity to rewire in response to environmental stimulations. And 1 to 3 years is the best age to teach speech and language to a child. So American Academy of Pediatrics recommends starting early interventions, starting especially below 2 years of age, and do not wait till the diagnosis is made because diagnosis may take some time. So all children should be screened for autism between 18 to 24 months of age using a screening tool by a pediatrician, and once the pediatrician suspects a child to be high risk for autism, the child should be referred to a developmental pediatrician. Or even if the parents suspect the child to be at risk for autism, they can come directly to a child development center or to a developmental pediatrician. Then the child is handled by a multidisciplinary team of developmental pediatrician, pediatric neurologist, clinical psychologists, occupational therapists, special educators, speech and language therapists. And parents are a part of the core team. In the diagnosis, hearing assessment is very important because there is speech delay, and other tests are done based on the clinical features and decided by the doctor. A detailed evaluation is done by the team using autism diagnostic tools. And once the diagnosis is made, or even before that, early intervention is started once we suspect autism. Early intervention involves intensive behavior modification therapy to teach non-verbal communication, speech, improve cognition, improve the independent self-help skills of the child, and to ameliorate the problematic behaviors of the child. Occupational therapy, especially by a therapist trained at sensory integration, aims to develop self-help skills and fine motor skills and to ameliorate the problematic sensory behaviors, because if the child has problem with sensory issues, then the child can have difficult behavior, difficulty in learning, especially, and also in feeding. A special educator aims to give remedial education to help in academics, and a speech therapist aims to develop speech of the child. It has to be individualized, goal-oriented, intensive, systematic model where we review it from time to time because the development also changes from time to time. Parents are a part of the core team. At least 25 hours per week of therapy should be given, which means some hours at the center and then followed by at least 1.5 to 2 hours at home. Therapy should be done. And coming to the medications, there is no medicine to cure autism, although we can give medicines to ameliorate the problematic behaviors. And prognosis, the earlier we start, the better it is. For any further queries, you can contact me on Librate.